Hi everyone, welcome to week 3 of your Medical Language 2 course. This week we're going to be covering 2 chapters. The first chapter is chapter 19, and it's all about terminology related to the oncology patient. When we think of the oncology patient, what we're thinking of is a patient who has some form of cancer. So when we talk about tumors, that's what oncology is. It's the study of tumors. Basically, we're looking at 2 different types of tumors, either benign or malignant. When we think of that, we think benign is the kind that's not bad, I guess you could say. It's a localized tumor. It doesn't spread and grow. Malignant is what we think of as cancer. Okay, so if you're thinking about cancer, we're thinking of a malignant tumor. That's the general term, is for cancers, just those malignant tumors. When a malignant tumor spreads to other areas of the body, we say that it's metastasized. So regardless of where the tumor starts, that's what we call it. So if we have breast cancer, it's breast cancer no matter where it is in your body. So if a patient has breast cancer and it moves to the lungs, the liver, wherever, it's still breast cancer. It's just metastasized to some of those other areas of the body. You're going to see that suffix OMA used to designate tumors. So anytime you see OMA at the end of a word, that's what you're going to know that that's some sort of a tumor. So again, as we focus on the pharmacology behind a lot of this, we want to make sure that we're recognizing some of those things that allow us to communicate with patients. So anytime you see that OMA, you know that you're talking about some sort of cancer. There's lots of different risk factors that that patients can have that could lead to some of these cancers. Genetics is obviously one that most of us are familiar with. If you have anyone who's ever had things like breast cancer, that is typically a genetic type of cancer. Viruses can be cancer causing. The HPV virus is the one that's most known for causing cervical cancer. Radiation, chemicals, those are all risk factors. Biologics, aging. As our patients age, you will find that they have more likelihood of contracting certain types of cancers. Diet can be cancer causing, hormones, all of those things. We stage cancer. In other words, we classify it by looking at different things. And by staging it, it helps to give a prognosis. So we can kind of have an idea of what kind of recovery we may or may not be able to expect, depending on the stage of a particular cancer. And it also then gives us an idea of how to proceed with the course of therapy. So we look at the size of the tumor, the extent of involvement of the lymph nodes, and whether or not it's spread. That's all used in determining what stage of cancer a patient may have. The last part of this chapter covers some of the general terminology related to oncology. Antineoplastic is, we usually classify the drugs that are used for cancer treatment as antineoplastic. So you're going to see that term kind of used interchangeably. Some of the other things that you're going to want to pay attention to as you read through the last part of this section, obviously, we've got some of those pathological conditions that end in that OMA. But I also want you to make sure that you make yourself aware of some of these actual medications that will be used with our oncology patients, because we don't just give them the medications to treat the cancer. There's a lot of other drugs that go along with those cancer agents. So these are just some things that are listed here. Antiemetic drugs are commonly used when we're treating nausea and vomiting that comes along with chemotherapy. So that's going to be something you'll see very frequently. Then our chemotherapy drugs are actually categorized as well based on how they work. So some of them are actually a type of antibiotic. Some are hormonal. For example, prostate cancer is treated with some hormonal types of drugs. Um, and these are just some more categories of the anti-neoplastics and how they work in the body, and actually categorizes those drugs. Then after you finish with chapter 19, we're going to be looking at chapter 20 this week, and this is where we're going to kind of get into some more actual pharmacological vocabulary. So things about, dosage forms, desired effects, adverse effects, all of that kind of stuff. We're going to just start the tip of defining things. So, what is a prescription drug? What is an over-the-counter drug? Where do drugs come from? That type of thing. Where do those names come from? And for those of you who've been working on some of those assignments and you've been asking about drug classifications, those are included in this chapter as well. So how we classify a drug, what group does it belong to, and then what are some examples within those groups, and what's that group used for. So all of that is covered in this last chapter. If at any time over this week you have any questions or problems with these two chapters, make sure you reach out to me. My email, my phone, or my text would be the best way to reach me. My number is 618-792-2293. Have a great week.